believe there's a lot of interest in these two topics, COVID-19 and AI and big data analytics. So how can we combine these two together and actually share with you all what is the possibility out there and how AI and big data analytics are able to help to combat COVID-19. So I must stress that this particular session won't be covering a lot of items in health sciences or medical sciences in regards to how they use the CT scan image to be able to detect faster and better than doctors. We are combating a new frontier. Why I mentioned that this is a new frontier? Because while there's a situation like this happened in the past, for example, SARS, MERS, or even Ebola, but the impact of those diseases or virus are actually less impactful and less contentious, and therefore there's no such a widespread damages to people's health as well as economy. That lies the challenge of AI and big data. We don't have sufficient data to analyze the past and predict the future. And what we can do is right now to learn from the fry and to learn from multiple disciplinary that pose another challenges. Why I say that? Because in actual fact, when we want to help organizations to reduce credit risk, we just need to talk to a banker. But right now, it involves many parties. All these parties or disciplines need to provide us with data as well as the rules, the conditions for AI to learn and for AI to help the nations and the region. Different countries has different definition of stages. For AI and big data to work, to deal with the different stages, there's different requirements. They are, as we know, two major activities. The first activities is about predicting potential patients. So we need to find out who potentially got infected, have to isolate them, and we have to start interview them or let them to self-declare so that then we can start this process called contact tracing. We have helped the banks, the insurance company, even the government agencies to detect fraud and also to help them in investigations. So what we do then, using big data and AI to get all sorts of possible data together and put in the rules, put in the conditions, train using machine learning to produce what we call suspected score. And from there on, based on the severity of the suspected score, we can then venture down into investigation using what we call knowledge graph. And this knowledge graph basically would help us to trace the linkage between the transactions, the persons, the entities, so that we can see who is scaling up from and so forth. By linking these two situations together, fraud detections and COVID-19, we found that, hey, the entire mechanism, the entire methodology can be applied to predict potential patients and then to perform contact tracing using machine learning and using knowledge graph. So what needs to be changed, of course, is that we need to learn from the parties that I mentioned, from the disciplines that I mentioned, the police, the doctors, and also the immigration officers and so forth, on the conditions, on the rules, so that then we can produce the suspicious score of the potential patients. And once we find that, we can get the police to be easily using the knowledge graph for contact tracing. So in this case, the actions will be much more prompt and to bring down the cases into a more controllable fashion and hopefully getting down to zero. As we take a look into the China as well as in Korea, it's a top-down decision at the country level, but it's also based on the local situations and executions. What AI and big data analytics can help here basically is to answer this kind of critical questions. Now let's make assumptions, right? There is a potential patient being detected, or he or she himself actually reported to the authorities that they are suspected themselves as a patient. So what, as an authority, you need to do? You need to decide which ambulance to pick up this patient and send to which hospital, and it's all based on availability and optimizations, right? Next off, you need to ensure that, assuming your medical is still in a very healthy situations, you can now assign relevant medical personnel as well as equipment, wait for the arrival of these patients to conduct testing, isolations, further testing, treatments, and so forth. All these decisions right now are made by human, and every day they have to do all this decision. If there's automated decision making as well as recommendation, it will save a lot of mental power for the authorities, as well as less constraint in terms of resources. Other decisions that AI and big data can help to detect is, for example, like in a geographical area, where are the vulnerable group? For example, old folks home. So there are situations like in Singapore that old folks home become a cluster, which is a very serious situation, right? And that need extra protections, and how authority can protect them. So potentially there can be a scheduling of more authorities around this area, so that then there's no unauthorized access to this vulnerable group. More importantly is that, especially in the reopening phase, we are talking about emerging cluster. If you see signs that they are locations of little group start to emerge from the knowledge graph, and you can find linkage between parties, that's when further actions on isolations, bringing down the kind of control will act in concert, and therefore the actions can be more prompt and faster. The next question, of course, is what President Donald Trump always wanted to talk about. When can we reopen, and when can we reopen the sectors, and also to allow for which kind of activities? Is haircut allowed, right? Is haircut having a lot of human touch or close contact? And how about manufacturing, and how about this, and how about that? So all these decisions can be factored in to an AI system, so that then the results can be automatically generated, and the decision maker will just need to approve or reject or amend the decision, rather than they themselves have to make a calculated risk or worst case gut feel. However, having said all that, we know things are not that easy, right? The disease or the virus is extremely contagious, right? And a lot of times the person who got it doesn't have any symptom. Worst situation is that we are talking about availability of data, right? A lot of data is not readily available. I'll give you some examples. In order to have all this working, these are the kind of data sets that we have seen that's possibly able to help to do predicting the potential patients, as well as contact tracing. We need items like IC or ID from different countries, right? The NRIC here in Singapore, Malaysia is IC number, as well as NIC in Indonesia. So in their households, who are there staying together? The driving license if they are driving out, and also the immigration records and health records for the person, right? So that poses the challenge of getting all this data together. And next is that we are talking about, in case we don't know who they are, but they pass by a location, that's all about facial recognition, even with a mask. And by all means, AI can do that. Computer vision right now is extremely advanced, that we are able to detect that who you are, even though you wear a mask. And also, of course, if you are driving out, your car plate recognition, your car number recognitions. In the most serious cases, we can also get data from telco for mobile signals to trace the movement of a person from A point to B point to C point and so forth. And therefore, we try to link them against the time and who are around that area, right? Next, as we learned from the situations, once we the authorities detect the person, there's a lot of human involved. That human is a very precious human being, which is police, right? We need police investigator who is very experienced in interview to actually facilitate the interview to find out more information about where are these potential patients went to, who are they in contact with, which clusters and so forth, and they try to piece the information together. And AI will be able to process such unstructured data. Last but not least, we also seen a lot of advancement. I just saw the news that even Malaysia has produced something similar. So basically it's an area of contact tracing. And through contact tracing, we'll be able to now switch on the Bluetooth, and so that the data between how close a person is and stay on for how long, they're able to detect, and therefore able to try to find the linkage between parties, and also find who may be potentially impacted by this. That's demoralizing situations. It's hard. Doesn't mean that we can't do anything as AI and big data analytics practitioner. I don't think at this moment AI can 100% predict to determine who are the patients. But definitely for the use of AI and big data, with all this in place, we can prioritize and speed up actions. And more importantly, is in a more accurate and faster way. So this is important in this stage because if things are slow, you are actually dragging on. It's a life and death situations, number one. Number two is that if this is slow, the infections may be getting out of control, right? So we are talking about multi-generational infection. So I infected you, you infected other parties. Every single hour's delay, every single days of delays, there will be more people being impacted. So speed becomes extremely important, and AI and big data can help, right? So what we can help? We can help to enable precise provisioning of funding, supplies, and medical staff to a cluster, right? And we can also down to individualized protections. For example, there's a patient, which hospital to send to, which staff to attend, and also which ambulance to be sent to. So this kind of decisions can be automated, and we can also determine reopening and partial reopening of public spaces as well as sectors. That will help the normal flow of economy activities again. Now, when I spoke to some of these government officials in different countries, one of the biggest questions recently is that, hey, are we too late? My answer is, it's never too late. Though I would say that with the strong humanity, we are able to combat and overcome COVID-19 in due time, though we don't know when, right? However, we are not going to discount the fact that there will be wave number 2, number 3, number 4 coming in, and also the fact that there will be COVID-21, COVID-23, and so forth. So setting up our IT infrastructures that may need some time to be able to work very efficiently, but it's a good starting point. While during the next situations, the rules, the conditions, the data could change, but we can just merely refresh them, but we are using the similar infrastructures and methodology to help the government. Therefore, we are suggesting that this is a good point for us to implement something to help the countries to combat COVID-19.